People believe in mammograms. People believe in colonoscopy for colon cancer. They believe in pap smears. They believe in rectal exams for prostate. And this is really the disease that's going to kill half of us, and it's really the mammogram of the heart.
That is cardiologist Larry Santora talking about how heart CT scans are crucial for cardiovascular health. These scans have long been valued in dealing with heart health questions, but now a new study conducted by Duke University is bringing all of that into question.
Yeah, patients are generally recommended to get a heart CT scan after seeing a doctor for chest pain, but the study shows that patients who receive the scan have no less risk of a heart attack than those who take a simple treadmill test or an older exam.
So, has this new study changed the whole value of these heart CT scans? Here for our heart health, or our Heart Matters, our Health Matters study and segment. It's important to my heart and the health. Yes. A guy who's a good friend of ours, Newsmax Deputy Health. He's got more than just a little heart. He's got a massive brain. It's Nick Tate. And Nick, despite my difficulties with syntax, it's good to have you back here. Tell us how these scans work.
Well, essentially, these CT heart scans provide a 3D image of the heart. And what it does is it gives doctors a clearer view of the arteries to determine whether somebody coming in with chest pain has a blocked artery that could in fact lead to a heart attack. The problem is they give about 500 to 600 times the dose of radiation that comes from a standard X-ray. And what this latest study from Duke shows is that they're no better at identifying people who are having heart problems than a standard test like a treadmill test. Plus, they're very, very costly. They cost twice as much as a standard treadmill test. So, you know, chest pain is one of those things that can certainly be indicate that you have a blocked artery, but it might be something as simple as indigestion. So these very high cost, very high radiation level tests are now being questioned by this Duke study, and this is another one of those tests that is a reason that we spend so much in this country on health care, on unnecessary tests. Doctors often do it to practice defensive medicine to stave off medical malpractice cases, but in this particular type of test, it's really no better than a standard treadmill test.
Nick, it sounds like the same argument that we hear about mammograms. How often should women get them? Are they really getting them because they need them? Are they getting them because doctors want to make money? Are they getting them because doctors are practicing, as you pointed out, defensive medicine?
Larry, you're absolutely right. The question is a one-size-fits-all solution the best way to go in treating and diagnosing folks with heart conditions, which are, of course, the leading killer, the #1 killer in this country? Like with mammograms, you really, as a patient, need to be clear with your doctor. Your doctor needs to be looking at other ways to identify. First do the simple stuff. Do the treadmill test. Do the other exams that don't cost a lot of money, don't put you at risk of getting 500 to 600, the equivalent of 500 to 600 X-ray radiation levels, and then you can maybe proceed to a more aggressive test if it's necessary. But you know, we've been too quick to embrace this technology because it's newfangled, it's fancy, but this study shows it's not any better than a standard treadmill test.
Nick, Newsmax reports of a new drug that can cut the risk of heart attacks in half. What's the latest on this? That's
right. This is a new drug that's a new breed of a new breed of drugs called biologics that, unlike conventionally chemically synthesized drugs, are derived from natural products. Typically, they're engineered from human genes. What the researchers found is that when they paired the use of this drug with a statin, it cut the risk of heart disease, heart attack, and stroke by almost 60%. So there's some combination factor that really amplifies the ability of a statin to keep you safe from heart attack and stroke. Now, I should point out that these new drugs are really only 10 years old or so. They're brand new, and the FDA is now looking closely to determine whether they're safe and whether they're truly as effective as the preliminary studies show. But this latest research is very, very promising. As I said, heart disease is the #1 killer in this country, so anything that can help reduce the risk of heart attack is going to be helpful, and we could see this drug become a standard regimen, standard treatment in the next year or two if the FDA in fact fast tracks their review of this study, and it seems merited in this particular case.
Well, that's some promising news, and there is more promising news if you get a very important book, Da Vinci's Baby Boomer Survival Guide. A baby boomer like me needs it. You can get it at babyboomers711.com. There's more straight ahead. Stay tuned.